So today we are going to be looking at what we call straight leg hip flexion. In layman's term, what that means is we are going to be improving hamstring flexibility and hip mobility. So, what we want to think about when we're stretching this hamstring is, first of all, we want a very slight bend at the knee and we want to pull these toes back up towards the hip. The reason we want a slight bend in that knee is if we fully straighten the leg, we're going to be stretching our sciatic nerve in that leg, which we don't really want to do. With the back leg, try and maintain a straight leg position throughout the whole movement. If you find it more comfortable to slightly bend that leg, that is absolutely fine. We just don't want that to change throughout the whole of our PAILS and rails contractions. So as usual with our PAILS and rails contractions, we're going to spend 2 minutes in the deepest stretch that we can. From that position, this means driving our belly button as far over this knee as we can without compromising the position of our spine. The sticks are here for two reasons. Firstly, to help with balance, and secondly, when we get into our PAILS and rails contraction, to help build as much tension through the body as we can. If you don't have these, that's fine. You can either use something similar or just use your hands to help you build tension. So we're going to spend 2 minutes in this position, using our breath to get comfortable. 4 or 5 second inhale, 8 to 10 second exhale. So for our PAILS contractions, if you have 6, put them at arm's length and start to drive them into the floor. Start to feel tension through the leg here, transfer that tension through your whole body. And our PAILS contraction is where we are getting contraction through the lengthened tissue in the hamstring. So Rachel is going to not just push her heel down into the step, she is also going to try and drag it back towards her other leg. Again, 20-second contraction. After that 20 seconds, maintaining this posture, switching the contraction to the rails contraction, the tissue that is shortened here. She's going to maintain this position and try to lift her foot off the chair. She shouldn't be able to because she is in her deepest range of movement. So think of it as actively trying to pull yourself deeper into that range. Another 20 seconds, ease the tension, couple of breaths, repeat again, and as always, hold for a minute in that newly acquired range.